Welcome to this interview cruncher organized by GAIN, the Global Alliance for Improved Nutrition. Today, we're talking about what's at stake for urban food policy. We're going to be discussing the findings from our Keeping Food Markets Working during and beyond COVID-19 rapid assessments conducted in 6 cities located in 3 low and middle income countries. These are Rawalpindi and Peshawar in Pakistan, Kiambu and Machakos in Kenya, and Beira and Pemba in Mozambique. Each city has different social, economic, environmental, and governance contexts. I'm Anne Trevenant-Jones, Senior Associate for the Urban Governance Program at GAIN. I'm joined today by our speakers from the Expert Advisory Panel who support us in this work. Before I continue, a few housekeeping notes just to keep track of as we go forward. So just a note that we will be, for example, if you want to ask questions, please, if you look at the bottom of your screen, you will see a Q&A icon. Please jot your questions down there and we will keep track of them and come back to them at the end of the session. We will try and cover everybody's questions at the end. So please just keep posting away. If you need to look at interpretation, we have interpretation into Swahili as well as Portuguese and Urdu. Please look in the right-hand section of the bottom of your screen for interpretation as well. And just have a look at the instructions on this slide. So moving forward, it's my pleasure to introduce our first speaker, Obey Nkaya. He is GAIN's Senior Advisor for Food Systems Transformation, and he is co-chair of the Expert Advisory Panel.
Thank you. Thank you very much, Annie. Good afternoon. I'm going to just speak a little bit and set down the context of this discussion this afternoon by introducing to you the objective really of this work stream 5 of keeping food market work during and beyond the COVID-19. So this work stream really focused on identifying policy, needs, and opportunities to keep urban food markets working. And it aimed at facilitating evidence-based policy and coordination option so that really cities and can build future food system resilience that ensures availability and access to safe, desirable, and nutritious food for all urban residents, but really especially most vulnerable, but keeping on the gender lens, because really both men, women, girls, they have different but sometimes similar needs of the market needs. So for us to do that, to build that evidence, we put in place the experts who formed the what we call expert advisory group in September. This is a 12 member panel, really, which helped us to provide the technical advice and support to build this evidence. And these members are really of diverse knowledge and expertise from public health, food safety, gender, urban governance, planning, and coordination. So the panel is really rich, and they work within our 3 countries, which my colleague Annie just mentioned, 3 countries, and others sit at the global level to provide that expertise all together. So they worked with us to review the evidence and provide input on policy, on the coordination mechanism as well. So these expert groups has really helped us to go through and come out with some evidence, which we are going to share specifically some of these findings. But suffice to say that the evidence which is going to be provided is specific, context is specific to some cities which we were working off, but some can be borrowed, especially the framework for other cities to build on their, resilience. But really the findings are specific to markets, because the markets are different from one country to another, and even within the country, this condition of the markets are different. Even the measures employed during the COVID can differ. Some would have total lockdown, some would have different in market, opening the market, so the solution are quite different. So now we are way forward. We are conducting a policy workshop in each of the 60 cities, which will build on evidence from people in the cities, because we want the market actors really to be part and parcel of this, to generate solution which is fit for them. It's not only about policy, the government rules and regulation, but to put these market actors to be part and parcel of the solution. For example, to design together how to put up the infrastructure within the market, which will ensure that the food which is brought to the market is stored for safety and also to take a longer shelf. So they should be part and parcel of. So this policy workshops are ongoing, and we are glad that I think they will be part and parcel of bringing all these people together in terms of coordinating them to provide a solution. So we want this partnership really to be robust and continue, so that we build resilience beyond even COVID-19, so that the market will continue operating and making sure that really the solution which are obtained involve all the actors in the market, not only a few of them. And I think the evidence will provide that that one can work very well. But I really, as a way forward, in next month, we are going to produce the fact sheet, which will show us what some of these things have been in place and how can they taken forward. But in September also we'll use the policy toolboxes, which will be also important for future. So for today, really, we are going to focus ourselves in that work stream 5 and see how these solutions can be important to our cities we are working on, and if can be borrowed, but really adapted, not one size fits all. They are quite different, but they are important for the market to work. Thank you.
Thank you, Obey. That's very interesting. Could I ask you, you mentioned this one size fits all, so the focus on each city is so important. And we hear a lot about national evidence and subnational, regional evidence. And this study has really been focused at each city. And the evidence has been, in some cases, very different. How do you think that's valuable in empowering all the urban food system stakeholders, from government, city governments to market councils, in determining their future resilience and decision-making?
Okay, thank you. I think, to me, this evidence and whatever we got, it is very useful, like we said, to empower these local people as they have been involved in the development of policies that affect them. We want to bring together those market actors to be part of the solution, really. It's not that they are just there to listen to what they are saying. So that evidence can bring all of them together and, be pattern solution. For example, what kind of environment do you need to produce, policy environment, for these market actors to be part and parcel of this system? So that one, whether it's vendors, the consumers, or the policymakers within the cities, can be put together. This evidence can glue them together to say, these are the solution which will build resilience in the long term. So to me, this evidence is very, very useful to these specific cities. And when we apply it, it can really help us to make a step forward on how coordination and of the market actors can play a very great role in making the market work and building resilience in future. So to me, this building the capacity and empowering the market actors becomes important for the resilience. Thank you.
Thank you very much, Abe, for your insights. Moving on, I'm pleased to give the floor to Genevieve Fernandez, Research Fellow in Global Health Governance at the University of Edinburgh. She's part of our expert advisory panel that has been focusing on Pakistan, and she will speak to the rapid assessments conducted in Rawalpindi and Peshawar. Thank you.
Thank you so much, Annie, and thank you, Obe, for really introducing the whole setup really well. And today I will, from the work conducted in the two cities in Pakistan, in Rawalpindi and Peshawar. But before I begin, very quickly, I'd like to just share that today I'm representing GAIN's expert panel member team from Pakistan. And I work very closely with three of my colleagues over there, Muhammad Aslam Shaheen Sahab, who's got more than 3 decades of experience in nutrition policy and planning, Rafia Haider, who is a member of the Pakistan Administrative Services, and Caroline Omondi, who is a seasoned supply chain expert. So all of the insights that I'll be sharing at least are really a result of solid teamwork, and my thanks to my colleagues from Pakistan. So I will try to unpack 5 key insights, if I can, in the next couple of minutes. The first bit is about the similarities and differences between these two cities in Pakistan. So the city of Rawalpindi, colloquially known as Pindi, is located very close to Pakistan's capital city of Islamabad. It's got a lot of industry base for the nation's armed forces, whereas Peshawar, the other city, it's located in the KP province on the northern side of Pakistan, bordering Afghanistan. So now both these cities have about 2 million inhabitants each. They both have a particular ethnic majority. So those are the kind of similarities, right? With respect to food markets, both of these cities have markets that are sort of strategic hubs for markets in other parts of the country. So the key points we need to bear in mind are there's a lot of movement of people, there's a lot of movement of foods. They're central hubs for food systems in both those provinces. Now, from the rapid assessments, we also identified some more similarities. For instance, most of the vendors that we surveyed were men. And this tells us about the sort of cultural aspects about Pakistan, where it's very common to find men outside in the market, and it's very rare that you would find women. I mean, they are part of the food supply chain. They're also work as vendors, but they're really invisible in the system, Most of the vendors in both the cities, they had self-owned businesses. They had intergenerational businesses. And so these are the basic similarities that we found in both the cities. But with respect to COVID, vendors had high levels of awareness about COVID. Most of the vendors, they supported and they wore masks. So that's a positive finding. There is a general support for universal masking. But there were differences in practice of behaviors. For instance, more vendors in Rawalpindi, we found who stated that they frequently used sanitizers, or they had set up hand washing stations, or they had cleansed the surfaces around, whereas lesser number of vendors in Peshawar had reported practice of these behaviors. So we can see that within the same country, there are two cities, so there are different kinds of levels of behavior that are being practiced by vendors. Another key insight was that even with respect to behaviors, there were certain behaviors that vendors were practicing much more. Behaviors such as masking, behaviors such as use of sanitizers, right? So these are behaviors that are within the control of the vendor. Whereas there were certain other behaviors such as reminding the customers to maintain distancing, or asking the customers to wear a mask, or certain other behaviors that were outside their control, the percentage dropped. So that's the key insight that we need to bear in mind. What is within the control of a vendor, and what is within the control of other more powerful stakeholders who could then influence such behaviors. The second bit that I'd like to highlight, the second key insight, is around supply and demand. So in Pakistan, the supply was not so much of an issue. The supply kept flowing after an initial few days of lockdown. When it was lifted and transport was sort of reinitiated, the supply went through. But the demand was the area which was most affected. So even in terms of demand, there is household demand and there's commercial demand. So because millions of people lost their jobs, there was reduced income, and there was already an existing inflation for the last couple of years. So that affected households' purchasing power to buy nutritious food. So clearly we could see that there was a drop in demand for nutritious foods like meat, poultry, dairy, fruits and vegetables even. And there was a rise in demand for foods like wheat, rice, sugar, oil. So this is very commonly seen in certain poor parts of the world, where the demand for carbohydrate heavy dietary drops. Then because of COVID guidelines, there were closures of hotels, restaurants, big event venues such as wedding halls. They were all closed, or they were reduced operation hours. And this really hit the commercial demand for food. So because this demand fell down, the cost of foods in the local markets for local consumers increased. And again, that further affected the household demand and the ability to buy foods. So it's important to bear in mind that, all of these structural factors are all interconnected. So it's quite a complex web that needs to be carefully unpacked, as well as we need to understand that there are various actors in the market ecosystem, and therefore we need to understand the needs and concerns of each actor and also involve them in a participatory way, which is what GAIN is doing very well with respect to their policy workshops. Another point, the third point that I'd like to bring up here is, as I just said, about the various actors. My timer is up. I was given 7 minutes to speak. So is it okay if I go ahead, or?
Please just finish up. Thanks, Geneva. That's great.
All right. So just to wrap up, and I'm sure there'll be questions as well, but the research findings from Pakistan really showed us a couple of challenges, but it also highlighted a lot of opportunities. So, and I'll just quickly just say the two big opportunities. Of course, there were low levels of knowledge and information about certain things, but that's your opportunity to run behavior change communication programs. And the second opportunity is that there are several actors at the city level, several government agencies, non-government agencies, and coordination around these agencies. That's the big opportunity to harmonize existing resources for solutions. So thank you.
Thank you very much, Genevieve. If I could just ask you, I mean, there seems to have been different vulnerabilities compared to the vendors from all the different kinds of food providers in Peshawar versus Rawalpindi. And also the fact that, of course, Pakistan has more of a provincial management style of its food system. And we see all of these smaller markets, which are fruit and veg or a meat market. And how do you feel these different vulnerabilities played out? Thank you.
Right. So when we think of the word vulnerability, the immediate image that comes to us is, someone who's poor, the consumer who's poor, the consumer who's a woman, the consumer who is maybe widowed or a single parent. And certainly so, this is a key group, a key vulnerable group. But in this market ecosystem, and especially in the two cities in Pakistan, there were other actors that we found were also equally vulnerable. So for instance, the market provides a lot of jobs. So there are so many informal laborers, right? There are drivers, loaders, helpers, cleaners. All of these are almost invisible faces. They don't feature anywhere, but they're sort of the backbone of the market system. And the minute COVID hit and the lockdowns were imposed, these people lost their jobs. And they usually don't live in the same city. They're migrant workers. They come from other parts of the country and they live on less than $2 a day. So there's massive financial stress, mental health stress, job insecurity. That's one vulnerable group. And another group I'd like to highlight here are migrant laborers, again, connected. So in the city of Peshawar, which is very close to Afghanistan, you have a lot of Afghans who work in markets, and they're also equally vulnerable with respect to job security. So I think an important thing to bear in mind is to identify all the actors and then sort of also understand how each actor could be vulnerable and how we could address that in our solutions.
Thank you very much, Genevieve. That's very insightful, particularly providing us insights into Rawalpindi and Peshawar's food systems during COVID. I'm delighted now to move on to Jane Masindi, who is the chair of the Technical Advisory Group for the Agricultural Sector Network. That's called the Kenyan Private Sector Alliance, KEPSA. Jane is also part of our expert advisory panel, and she has really been part of the team that has focused on Machakos and Kiambu in Kenya. Jane.
Thank you, Anne. Thank you, everyone, for this opportunity. Hold on, please. So I'm glad to bring you the results from our studies from Kiambu and Machakos towns. Both counties immediately neighbor Nairobi County and serve loosely as a bedroom of the city, meaning that most people who work within the Nairobi municipality live and are renting and living outside Nairobi in either of these counties, amongst others. They are very similar in that the extreme poverty headcount is around the same, around 2.5, 2.2%, but that's where the similarity ends. Kiambu is around 5,600 feet above sea level. So it's basically a producer county. They produce a lot of their own food. So their their share in GDP from county product is 4.6%. As compared to Machakos, which is at around 3,700 feet above sea level. So water is scarce. So they don't really do a lot of agriculture. So it's a net importer of food from other counties. They have larger land accessible to them, but they don't really utilize it as opposed to Kiambu, which, if you look at it, the population is almost double in Kiambu than in Machakos. So from our studies, with that background, basically we interviewed about 85 vendors in both markets. In Kiambu, the ratio was 50-50, so to speak, age group from 18 to 65 years, 60% being 25 to 40, which is a good sign. Most of the vendors observed changes within the market. I need to bring out that when COVID hit, the government came up with mandatory instructions for everybody. So one was you must wear a face mask in public, and secondly, every public place must have something to either wash hands or to sanitize the hands. So these ones, almost 100% of the vendors had them in place because it was a legal requirement. However, social distancing was a bit of a challenge because if you look at our markets, when everybody attends these markets, there's really no space there's not enough space for proper social distancing, which then came out during the survey. Most of the vendors in both markets had challenges in social distancing requirements. Most people had taken their own measures, wearing masks, because remember I said that it was a legal requirement for you to walk around in public. So almost 90%, 100%, everyone wears masks and was using hand sanitizers and was aware of this because there was a lot of media attention to these requirements. The vendors in both markets reported that business had decreased. Now, the reason being, for these markets to function, people actually had to come to them. So with the restrictions that were in place, people were not allowed to leave their homes freely. And if you were to leave your home, you need to have had a purpose. And with that, they were not going to the markets really. They were, being around their homes. But then that also implied that because they could not do any economic activities, the people who are not employed, who are mainly self-employed, then again, the ability to spend money also went down. So with that, some vendors, especially in Kiambu, which I had said is a net producer, they had problems getting food to the market. So what happened was a mushrooming of car boot markets near their homes so that they don't have to venture too far. So product was actually not getting to the market. And then about 60% of vendors took to marketing strategies, but we don't know how this worked out because again, you needed to get people into the market for them to buy produce from you. And finally, vendors reported a change in their suppliers. Yes, they started relying less on suppliers and more on their own supplies because most of them then went into own production. We shall get into the implications of that later. For Machakos, we interviewed the same number of vendors. Most of them were female because it was found out that most vendors in the market deal with fruits and vegetables, and usually this is the forte of the females. Age group was between 18 to 65, and 69% being between 31 and 65. If you look at it, this is an older group than the Kiambu one. Again, most of them were adhering to the requirements for COVID-19. Again, there was a problem with social distancing because they were not used to that and the space provided did not provide for abilities for social distancing. Most of them had taken own measures, wearing face masks, using hand sanitizers, and reminding customers to keep social distancing because the motto was, you cannot serve anybody who doesn't have a mask. So 97% of vendors stated that a number of customers decreased, which is normal. There was restrictions. Less vendors undertook measures to advertise, marketing strategies to advertise, because at the end of the day in Machakos, people have to buy the food. They can't grow it themselves. So they still got to the market somehow, and there was some reduction in numbers, but not as much as in Kiambu. 58% of the vendors changed their suppliers, maybe to suppliers closer to Machakos. Some were getting them as far as Garissa, and if you know Kenya well, Garissa is almost to the northeastern to Somali. But then they had to reduce the distance between where the food was grown to where it was sold. So basically, In Kenya, we have held the first round of policy workshops, one for each county that was represented in the survey. And it was well attended by private sector, government, academia, development partners. The main comment that was coming out in both workshops was that we need to do a little more on food safety. Aside from the request for better market planning and infrastructure, priorities for different stakeholders included promotion of the policy of self-sufficiency for common staples, establishing traceability and quality control systems. Remember, with the mushrooming of car boot markets, it was very difficult to know where all this food is grown and the status of quality and safety of the food. So establishing traceability systems would help. And then we need to establish a policy for regulation of the informal markets. As I indicated earlier, these markets do not really fall strictly under any formal regulation. So the work has started now, but there's still a lot more to do. We need to strengthen policies on value addition, and this would help in the food safety. And then we need to strengthen policies on market planning and infrastructure, formalizing of businesses to leverage on ICT. When there was restrictions on movement, the businesses that survived were those that were ICT savvy, that set up home delivery systems, set up robust money exchange systems. But the vendors in the market were not used to this. They're not really tech savvy, so they're not used to quick change of practice. So we need to formalize these businesses, then support them with the ICT. And then awareness and behavior change, in as much as we've enhanced messaging targeted at various factors, e.g. COVID-19, the wearing of masks, washing hands. There's need to integrate food system curricula in institutions of higher learning. The earlier we start inculcating the food system thoughts into a young person, the better it is for the future. Governance, we need to support establishment of framework, platform for coordination between different actors. Now, the government is getting their act together in supporting both the national and the county government are really coming up with policies that will regulate these markets. But do they have a strong market system to support their efforts? We need to strengthen the market committees. We need to...
Sorry, Jane, can I just interrupt you there on the market committees, as you were saying?
Yes.
The importance there. And I think with the qualitative work that was done in the interviews and the focus groups, that's something that came up quite a lot. This kind of importance of governance, the disparity between for water and sanitation being provided in some of the markets, but then who manages it, who oversees it, it's run out of water or there's a break, as well as with, you were mentioning finance, the vendors struggling with mobile finance, which had become quite an important tool. Just trying to manage the repayments and people buying from them and then reversing their systems. So not actually having a clear enough regulatory system around that. Did you want to speak for a moment on that?
Yes, thanks, Anne. With the ICT, yes, I was getting to that on the policy and regulation area. What was happening is the government also gave a rule that we cannot use cash. We cannot pay for goods in cash. So therefore, we're leveraging on money transfer systems from the mobile phones. And what was happening is the system was not quite robust enough to check fraud. So what was happening was a vendor could sell her product. And when she's getting paid, the customer would then reverse before the transaction, before the money goes through, which was disadvantaging a lot of the vendors. And there's a whole chain of disadvantaged people, because once the vendor cannot get paid, they cannot pay their supplier, they cannot then pay, the goods, then the delivery of the goods is then affected. So what came out in these workshops is that we need to strengthen the system around fraud checks, so that even if it was easier for Kenya to adapt technology, but with this technology, we need to support the actors. that
Quite rightly. That's a very important point. I'm just mindful of time as we go through, but that is one of the key points is having the vendors protected as well, and also financially able to manage their systems. But so thank you very much, Jane. We're just running out of time here. So I want to hand over to Dr. Danielle Resnick. She is a Senior Research Fellow in Governance Theme Leader for the International Food Policy Research Institute, IFPRI. Danielle has been very active in our Mozambican cities. So just handing over to Danielle now. Thank you very much.
Thanks, Anne.
Okay, well, thank you so much, Annie, for the introduction. And I just want to highlight I'm just part of a larger team working on Mozambique. This includes Jota Nicolarea from the Milan Urban Food Policy Pack, Eduardo Senga, who is a director of the Confederation of Business Associations of Mozambique, Samuel Mabunda is professor at Eduardo Mondlane University in Mozambique, and Jane Battersby at the Africa Center for Cities at the University of Cape Town. So just by way of background on what was going on in Mozambique, like many other countries, COVID cases began appearing in late March of 2020, and the president declared a state of emergency on April 1st of 2020. In the subsequent months, the government implemented a number of measures relevant to the markets and very similar to what you just heard for Pakistan and Kenya. Some of these restrictions included mandating masks, altering stall layouts within markets to enhance social distancing, and setting up hand washing stations with soap and water or hand sanitizer at the entrance of markets. In addition, and unlike a number of other countries, the markets were allowed to stay open. They were not shut down, but the hours were restricted. So many of the markets had to close at 5 p.m. rather than 8 or 9 p.m. at night. And these decisions were quite relevant to market vendors because it had been revealed by the Mozambican National Institute of Health relatively early on in the pandemic that market vendors had among the highest rates of COVID-19 infection, even though most of them were asymptomatic. So under the GAIN project, we looked at the impact of COVID-19 policies in much more detail in 2 secondary cities. This included Beira and Pemba. So Beira is located in the center of Mozambique, in the capital of Sofala province, and it's one of Mozambique's major port cities. It has about 52 markets, but only around 13 are considered formal markets. The rest are informal. And then Pemba is the capital of Cabo Delgado province in the north of the country. There are only about 14 markets. It's a smaller city, but only one, the central market, is considered formal. The rest are informal. These 2 cities are not just secondary cities, they could be classified as fragile cities. Due to its location, Beira is very vulnerable to natural disasters, particularly flooding. It continues to recover from cyclones Kenneth, Ida, and Eloise. And all of these collectively destroyed a lot of the market infrastructure already. Pemba has also been affected by cyclones, but it's also facing a challenge of insurgent attacks in other parts of Cabo Delgado province. Estimates suggest that over the last 3 years, more than 400,000 people in the province have been displaced, and many have sought shelter in Pemba, which is a city of only about 200,000 people. So the city is dealing with the arrival of many internally displaced people. And so the demands on food access, which were already quite high, has been exacerbated with new arrivals. In addition, many IDPs are trying to make a living by vending in informal markets. So there was already quite a lot of pressure on market infrastructure, which is quite poor, and that's exacerbated sanitation and hygiene challenges, which resulted in the city already suffering a major cholera outbreak at the time that COVID-19 arrived. So let's turn now to think about some of the impacts that the COVID-19 policies had on market vendors. And to do this, the GAIN project had 2 different methodologies. One was focus groups with about 7 different groups in each city with a variety of stakeholders. Then that was complemented by a survey of 100 vendors in each city that was spread across 3 markets per city. And collectively, what was found from these various pieces of evidence was that one of the major effects for the vendors was this reduction in trading hours. So as I noted earlier, this was a major difference from some other places that the markets weren't shut, but the hours were reduced. And this had a number of negative effects on different categories of actors in the food system. So for instance, fishermen and women in Beira typically go out in the evenings to catch fish, and then they sell their catches to rush hour commuters. But the curfew meant that they were often left with leftover stocks of fish that spoil overnight. Similarly, fruit and vegetable sellers often lost stocks due to less foot traffic caused, again, by the curfews and the reduction in trading hours, as well as citizens' initial fear of going into the markets because of fear of potential COVID contagion. This disproportionately affected women in these cities because women disproportionately sell fruits and vegetables, while men are more likely to sell packaged foods. In Pemba, we also found that poultry farmers were losing money because they couldn't sell chickens due to the increasing cost of a box of baby chicks, because of supply chain delays where most of the imports of chicks come from Malawi. Poultry farmers were charging more money to customers, but customers were not willing to pay these higher prices. And so poultry farmers were stuck without gaining income while still having to continue to feed the chickens that they have. So there's a whole bunch of endogenous effects created by these different supply chain bottlenecks. Bakeries, in addition, were affected. Customers used to come at 5 p.m. to purchase their bread for the next morning's breakfast, but the curfews meant customers were not coming after work, and the bakeries in turn also needed to be closed. And in general, the reduced market hours meant that vendors were purchasing less stock because they were making fewer sales. This reduced the income of farmers, limiting their ability to buy seeds for the next crop season and potentially impacting their likely future income. So there are, of course, high-level impacts of all these dynamics on incomes and nutrition. In addition, I think what many people don't often realize is that outside of property taxes, markets are a major source of income revenue for cities in Africa. And this is also true in Mozambique. So lower incomes from traders and less willingness of suppliers to allow vendors to pay on credit meant lower revenue collection by governments in these two cities, which of course further undermines the ability of municipal governments to invest in the infrastructure needed to improve health, sanitation, and things like cold storage to prevent spoilage. So I think overall, the two cities selected in Mozambique for this GAIN project, they were already facing complex emergencies when COVID-19 hit. And by using the lens of urban markets, we can see not only how one crisis compounds others, but also the ripple effects of the pandemic across the food system and for urban service provision, even in a country that had a less stringent lockdown than many others. So let me turn back over to you, Annie.
Thank you very much, Danielle. Very interesting. I'm just wondering, the surveys are one thing, and you get behind the story there when you do the qualitative research with the focus groups and the key informant interviews. When you think about those different kinds of interviews and focus groups between Beira versus Pemba, some of them involved city government officials, policymakers, and others of them involved SMEs and vendors within the food system. Do you think that was there anything that emerged, maybe that's a better way of saying it, that vendors or SMEs were doing to take advantage and improve their situation, their circumstance? Or how did they feel about their relationship with the city governments in that context? Thank you.
Yeah, thanks. Great questions. Yeah, I think we saw a lot of different adaptive behaviors that I think also Jane and Genevieve were mentioning in the cities they were looking at as well. I mean, for example, in both cities, we saw vendors leaving their stalls to try to access customers via their car windows or out on the streets. So they, knowing that customers were afraid to come into markets because of potential contagion, the marketeers went out into the streets to try to get customers. Now that created some of its own tensions, but that was one way they tried to adapt. We also saw that some of the fishermen and women tried to freeze their catches to deal with the spoilage issue. That increased costs for them because freezing is not cheap. But that was one way they tried to adapt to the situation. In Pemba, one thing that was found was that some vendors were actually having their children sell their goods because children were less likely to be penalized for not wearing masks. So, this had some effects on child labor in the markets. And then we also found a number of vendors noted in both cities that they were offering discounts to try to attract customers, and actually trying to engage in some advertising behavior to attract customers as well and encourage them to come back to the markets. So those are just a few of the adaptive behaviors that we saw in the two cities.
Thank you very much, Danielle, and thank you, panelists. I think we're going to move on to our question and answer session now. Thank you very much. So I'm just going to have a look at some of the questions that have popped up. Amongst the different cities, there's 6 cities here. What do you think has been kind of the lessons learned or things that have really caught our attention that need address at the city level in terms of food system governance? I'm perhaps going to hand this over to Genevieve first. Thank you.
Thanks, Annie. I think the big lessons that emerged from Pakistan, at least, are that, of course, there are huge structural challenges, which I'm sure have been seen in other cities as well, right? The country, Pakistan has been undergoing a financial crisis. So there is a challenge when it comes to resources. There's a challenge when it comes to infrastructural challenges, issues. But I think the big lesson that we saw was that of hope. You have different government actors at the city level. You have the district administration, you have food safety agencies, you have the public health department, and many other actors. Each one is doing a lot. So the strength of actually improving coordination, improving dialogue and conversations, and sort of harmonizing these resources, while at the same time empowering those who are vulnerable. I think the combination of this can really be useful for food policy in both these cities. So I think that was one major lesson that we saw emerge from the work.
Thank you, Genevieve. And next question, I think I'm going to present to Jane. One of the things that I see that happened in Kenya was that these disruptions, even if it was small, were significant. So the person that offloaded the potatoes from the truck into the market lost their job. And this had wide-ranging ramifications, and things like men, although not always as active in the fruit and vegetable sector, in order to gain attention as a marketing strategy, would lower their masks and shout and become, in a sense, more vulnerable. So these sort of strange anomalies occurring. Jane?
Yes, Anne. My understanding from it all is that 3 words: resilience, innovation, coordination. The Kenyans are very resilient. So whenever there's a challenge, they look for a way to go around that challenge so that they survive. So when you see a man lowering his mask, he can't communicate with the mask on. So the next thing he'll do is shout. So what I believe would be the solution to all this is a better coordinated market system, where everybody understands what they are doing and everybody understands their part in the whole thing, so that when the man is shouting across to everyone, he should understand that while I'm shouting, I'm also a risk to everyone. So once that is understood, then who will coordinate the whole system? If we work at that, then we shall become more resilient as a society. Thanks,
Thank you. Thank you, Jane. And for Danielle, there's a question from the audience, from Gianfranco Galvez. He's interested in finding out what was the reasoning behind reduced market hours, and did the government, the Mozambican government, become more flexible throughout the time?
Yeah, that's a great question. So, we saw reduced hours everywhere across the globe. Governments experimenting with different closures and different curfew hours. And I think the motivation generally was a feeling that reduces congestion. especially if you do know that workers, congregate after work, coming out of offices, going to the markets, that tends to be a very high density period of the day when everyone's trying to get their food and get home and get on buses. And so reducing that density after work, I think was the main motivation for that. Now, I think we have seen the governments, be more flexible over time. In the beginning, there was quite a lot of enforcement, which was good. I mean, you want to see if you're going to have policies, you need the enforcement. So the police were enforcing, making sure that the markets were closed. But this policy has been relaxed over time as the pandemic has receded a little bit.
Thank you, Danielle. And Genevieve, another question from your side, really interesting insights. Could you go into a bit more depth into the major actors affecting the markets in Rawalpindi and Peshawar and their respective roles? And perhaps just going into a bit more insight in terms of how in Pakistan you have the fruit and veg section, the meat sellers, the different kinds of food sellers, and how they viewed government authority in terms of COVID in different ways. Thank you.
Thanks, Sadi. That's a great question. And I'm glad someone asked the question because I wanted to cover that. So what we've seen in both cities, really, first of all, in Pakistan, there are specialized markets. So you have a separate fish market, vegetable market, fruit market. You have some spaces that sell a couple of those together, but that's the general sort of environment. Now, within a market in both the cities, we saw that going from bottom to top in terms of power, maybe who cannot afford to go to a supermarket or a grocery store, they'll come to an open food market. Then you have market staff. So you have informal labor. The work, it happens on a day-to-day basis. Then you have vendors. Now the vendors, you have small vendors, you have big vendors who've been doing this for years, they have a lot of capital. Then you have market committees, who are generally government bodies that regulate markets, and they work with government authorities. And then you have various agencies within the district authorities who are supposed to sort of oversee the operations. Now, during COVID, what happened was the government was overwhelmed with implementing COVID protocols. So that becomes a challenge. Now, as I said, from bottom to top, that's where the power flows. So there is a bit of power dynamics here at play. And even if we tell the vendors, for instance, to observe certain practices, they may or may not be able to follow everything. Now, just very quickly, as Jane was talking about the example of the mask. So in the qualitative interviews from Pakistan, we saw that some vendors would felt that if they would wear the mask and not speak properly, or if they would not greet the customer or shake their hand, they feared losing the customer, because that's the cultural practice in those markets. So these are the cultural nuances that we need to bear in mind when we're doing behavior change communication for practice of preventive behaviors.
Thank you, Genevieve. Just over to you, Abe. There's a question here. Do you know what happened with cash transfer programming during COVID, and how did that affect market dynamics? Perhaps Danielle would also intervene there. I think what we know is that some of the vendors, or many of the vendors, didn't have all the correct paperwork to benefit from these social safety nets and cash transfers. Over to you, Abe. Sorry, Abe, just your mic.
Can you repeat your question, please?
Okay, so we had a question that was talking about, let me just get onto it, my screen has jumped, sorry. So basically it was talking about what happened to the cash transfers. How did different actors, for example, like vendors, benefit from social safety nets? Were they able to benefit? Did they have the right documents, etc.? Obe?
Yeah, I think cash transfer has been used as the mechanism to support the most vulnerable. And I think using the transfer, maybe using the mobile phones, has been used as the, as an efficient way to deal with the, the crisis like for COVID. So I think the beneficiaries might have some of the challenges, especially if they had maybe had some, they had borrowed some money from the telephone companies. So when that comes, that is deducted, and that affects the amount which they receive. I think to me, it was the best way of cushioning the vulnerable in the market.
Thank you, Obey. And just Danielle, do you have anything to add to that discussion?
Well, I think what we saw with COVID-19 in general is that there was a attention to the urban informal sector and their vulnerability. And so a lot of countries' social protection or cash transfer programs, which focus predominantly on the poorest of the poor, which tend to be rural located. I think we saw a shift in mindset with that in a number of countries that gave some small type of cash transfer program to urban informal vendors. Now in Mozambique, I do not believe that happened, but I think there are other ways we saw reducing the vulnerability, right? So one is, as I was alluding to, the kind of waiver of stall fees and operating license for vendors as a way to kind of, cushion their ability to continue operating without having that extra burden of paying those fees, with, of course, some negative implications for the local government's ability to kind of respond and invest in the infrastructure needed to address sanitation and hygiene issues. But yes, I think in many cities in lower and middle income countries, supporting the urban informal sector was a short-term policy with cash transfers. I don't know if it's going to be a sustainable policy, beyond the immediacy of the pandemic.
Thank you, Danielle. Just, of course, mindful of time. So thank you very much. If I can start off with Jane, just for some final comments. What is the key takeaway, Jane, or key action that you would like to leave us with today? Jane?
Thanks, Anne. My key takeaway from all this, COVID affected all of us. It was new to all of us, and we were forced into thinking of new ways to do business. The government, we partnered with the government, private sector. For the first time, there was a coordinating activity around provision of services to the masses. So, difficulties bring us together. That's my take home. We all need to get food on our tables, regardless of where in society you are. And we need to support the really small vendors to survive like the rest of the people. So a lot of policy work needs to go into supporting the SMEs and the smallholder farmers to actually remain resilient in the food system. Thanks, Anne.
Thank you very much, Jane. And over to you, Genevieve, your last takeaway comments.
So thanks, Annie. I would just say that the solution for resilient markets in Pakistan, and I'm sure in other cities as well, really lies in its people. And in three ways, really, what we really need to do is increase coordination between government agencies and use existing resources to the best possible way. Identify champions. So identify champions, vendors, champion market actors who will really coordinate this action on the local field, invest in their capacity, and then finally to safeguard those who are the most vulnerable, whether it's consumers, whether it's vendors, whether it's laborers, safeguard them through existing cash relief schemes as a current measure, but then also bring in long-term measures to make sure that they have that buffer when the next crisis hits. Thank you.
Thank you, Genevieve. And over to you, Danielle. Thank you.
Okay, well, thanks, Annie. Well, I think it's becoming a little bit a cliche that everyone's saying this, but I do think it's true that with crisis does come opportunity. And I think particularly in these two fragile cities in Beira and Pemba, where we've seen the confluence of multiple crises, environmental, man-made, and now this health disaster, It's a really kind of a wake-up call of a set of interventions that's key to tackle any of those crises to make the markets more sustainable and resilient and create decent livelihoods for vendors, including investing in cold storage to help with dealing with spoilage, obviously investing in hygiene and sanitation, improving spacing in markets, and even eliminating structures that retain heat and eliminate airflow. So I think this is kind of a good wake-up call for how to recreate these vending spaces to improve decent livelihoods for all.
Thank you, Danielle. And Obey, we've been learning so much today, particularly about how important every actor in the food system is, whether they're a vendor supporting many people behind them, whether it's their families or their extended families or employment opportunities. And not only that they've been impacted, but unlocking this potential in the private sector as well as in the vendors, not just expecting governance to sort out all the problems. Do you have any takeaway comments on that, Obey?
Yeah, I think to me really building this resilience in the market requires a well-coordinated, and creating platform that bring everybody together to generate solution. It's not only laws will make us to get everything what we need, but incentive for all these actors to come together to be part of the solution, and they own those solutions which they build together. It's not and some of this maybe solution brought by the government may have their own consequences if the actors are not part and parcel of it. So to me, coordinating, creating platform, co-creating solution together becomes important in building resilience in future. Thank you.
Thank you very much, Obey, and thank you for everybody who joined us. Just a reminder that this recording will be available to listen to later at your convenience in English, in Portuguese, in Urdu, and in Swahili as well. We're just going to have a quick look at another video, but thank you very much. Thank you for joining us. Bye.